Hi folks, this is the prep for lab number 9, feeding, elimination, and I and O. The learning outcomes that we have here are on your handout, so you can go over them there. I'm going to try to keep this short and sweet. I have added the last learning outcome, identified different types of ostomies and discuss care. I had left that out initially in your handout. This is per usual, you'll be doing your Mosby skills. I have some optional information on F.A. Davis that you might like to take a look at your leisure. They have a great bowel elimination animation on how to care for a colostomy. It's a 2-minute video. They also have bowel sounds that will go over hypoactive, absent, hyperactive bowel sounds. So you can take a listen to those and the usual readings. We will be doing this lab in lab stations. The faculty will discuss and demonstrate each skill station, and you'll be rotating through these stations in pairs. It's going to be half of it will be bowel and elimination, will be the first half of the lecture of the lab. The second half will be nutrition, I&O, and output. You will need to be reviewing physician orders. You're going to be writing a nursing note and creating a nursing note concerning results of an enema. You'll also be actually using an I&O sheet and determining percent consumed of food on a tray. I've thrown some clicker questions in here because I thought that'd be a nice way to just prime you up for this lab. So, proper technique of bowel assessment: A, B, or C. We've gone over this before, I believe, but I wanted to do it. This is a good reminder time. So, take a moment, and the answer is inspection, auscultation, and palpation. That is what we had earlier in the semester. You state in your documentation that patient bowel sounds are absent. How long does it take you to auscultate to determine this? And I'm going to leave you this for a second. And the answer is actually 5 minutes. So you need to listen to quadrants, and then if after 5 minutes nothing, then you can document that they're absent. You're going to be using, getting your hands on a soap suds enema and actually administering a Fleet's enema. You do need to check physician's orders. The picture that we have here on the lower right-hand side of the screen is a what I call a soap suds enema or cleansing enema. We are going to have you actually get your hands on this, load it up, demonstrate how you would actually administer this. And the purpose, of course, is to relieve constipation, or we might have to do a bowel prep, something so they can do like a lower GI or that sort of thing. And on a rare occasion, we might have to administer medication this way. What temperature should the water be for a soap suds enema? This is multiple choice because I want you to get to thinking centigrade and also Fahrenheit. So there are two options here. This, of course, is in your text. I'll give you a minute. Okay, you can see 105 to 110. You'll actually be able to pour water. There's a thermometer that you'll be able to measure the temperature for this to get an idea of what it was be. I ran across this picture and I wanted to share it with you. This, if you can take a look at this, what is the issue here? This is somebody that sat on a bedpan or a commode too long, and you can see that this person actually is having tissue breakdown. So I hope in your practice that this will never happen, and be able to help prevent this, because this is perfectly preventable complication. Fleet's enema, you're going to be actually administering these. No need to heat these folks up. You can keep them at room temperature, and the faculty will demo this for you. Suppositories, there's all different types. We're going to constipation antiemetic, which is for nausea, antipyretic, antipyretic, and an antispasmodic. You can look up those words, but those are pretty much words that you're going to be will be using from here on in. Always need to check orders before you use these, and we will be actually using glycerin suppositories in lab. The position for inserting a suppositories is left sins or left lateral position. You can take a look at those, and you always want to make sure that you examine the area first, and actually how to administer. You'll be doing that in lab 2. Fecal occult blood testing, or testing for stool for guaiac. We'll be doing this in the lab, and this is a sample of actually what we call point of care testing, and you will need to be documenting this too. So that'll be a station. When performing an occult blood stool, which color indicates a positive test? Red, blue, purple, or green? And the answer here is blue. So that's what you'll be looking for. If you don't have any colors, then it is any colors at all, it's going to be negative. It's either blue or nothing. A physician is ordered a stool for occult blood. Pre-procedure, you inquire about the patient's dietary history for the past 24 to 48 hours. You know that there are foods that will cause false positives in this test. These foods are, now, is it broccoli, peanuts, and fish, onion, fish, and oranges, spinach, beets, fish, red meat, chicken, and fish? So it looks like fish is in all four. And I'll give you a second. The answer is red meat, chicken, and fish. Interesting. So that's one thing that you'll be requiring as when you do this test. The second half of the lab will be we're talking about nutrition, diet orders. There's all different kinds. Barbara will be talking to you about that. You'll also be checking your physician's orders on that. We have samples. I've put samples here of different types of diets. This is a regular diet, soft mechanical, and liquid. You'll be working with folks on all different types of diets, so it behooves you to really understand what it is and why they're on these diets. Intake and output is something that you'll have two stations for this, and I always look at this and I think of it's all about fluid balance. And my question is, what is fluid balance, and why do we care? Why do we care? That's something that I'm going to let you ponder and think about, and I hope that they talk about in lab. Which of the following are calculated for an input on an I and O? This is multiple choice. So I'll let you read through this. PO, IM, intravenous, tube feedings, urine. All right, so PO, IV, tube feedings. The intramuscular injections are not calculated, period, and urine is certainly an output. We're going to be going over ostomies. There are all different types of ostomies: ilio, transverse, descending, ascending. Why would we care where it is? What does it matter which one it is? Nursing wise, it really makes a difference to know where it is in the GI tract, because the output is very different from an ileostomy to a sigmoid colostomy. They're very different in what you can expect from those two. Ileostomy is less digested, sigmoid colostomy is much more digested. And what do they have in common? They're all part of the GI system, and they're portions of the intestine. They all have stomas. We'll have we'll have a mannequin in the lab that actually has all different type of stomas that you'll be able to take a peek at and identify. There's a lot of assessment that goes on as far as the stomas, and you actually need to understand the care for ostomies. So that'll be in the lab too. So this has been short and sweet today. If you have any questions, please talk with your faculty. I will not be available for the labs, but I think that this is straightforward, and I'm thank you for being flexible as far as moving the labs around.